Hello, everyone. Welcome back to the Meet the Member series. Today we have with us Kieran Walsh from BMJ. Nice to meet you.
Nice to meet you, Marta. Thank you. Thank you for having me.
Can you please introduce yourself and tell us what your company does?
Yeah, fantastic. Delighted to. Kieran Walsh is my name. I'm clinical director at BMJ. I'm a geriatrician turned editor turned educator, and I work at BMJ across a number of different resources, including BMJ Best Practice, BMJ Best Practice Comorbidities, and also BMJ Learning, and more about all those in a second. About the company more broadly, BMJ stands for British Medical Journal, but we say we're not British, we're international. We're not medical, we're about healthcare more broadly. And we're more than just a single journal. We're a values-driven company, and our vision is really clear, trying to achieve a healthier world. And we do this through partnerships, and we partner with over 11,000 organizations around the world, influencing medicine, but also medical education, policies more broadly. And so what does that really mean in effect? It means we publish journals such as the BMJ, also clinical decision support resources such as BMJ Best Practice. We also run events such as the Quality Forum, and every year millions of individuals, doctors, healthcare professionals, and others access our resources and contribute to our resources, and they're part of BMJ as well. And we want similar things to happen in Spain and through the Barcelona Health Hub.
That's actually a very broad picture of BMJ. So, what makes BMJ actually stand out?
Thank you. So I would say the BMJ, the journal itself, it's been around for 180 years. It's one of the top medical journals in the world, and it's built its reputation on research integrity, involving patients, and implementation of research. We've also been part of the evidence-based medicine movement in healthcare more broadly for as long as evidence-based medicine has been around, since the 1990s. But of course, it's continually renewing itself. And sometimes people talk about real-world evidence-based medicine, and we're interested in that and involved in that as well. And what does that mean? It really means, how can we implement evidence-based medicine? How can we overcome barriers to the implementation of the evidence? And sometimes there's lots of barriers. One of those is comorbidities, i.e. patients who have multiple conditions. And so BMJ Best Practice Comorbidities has been developed to help deal with that particular issue.
Okay, so what has been your company's biggest success and then your biggest failure?
So thank you. So focusing on successes, first of all, BMJ Best Practice, our clinical decision support and knowledge resource aimed at doctors and other healthcare professionals. It's been around for about 10 years, but it's continually innovated and improved and expanded in this time period. And it offers essentially evidence-based knowledge to doctors and other healthcare professionals. The content's continually improved, it was continually updated, and also practical and accessible. And more recently, as I was saying earlier, we developed a new resource that's now integral part of BMJ Best Practice, the BMJ Best Practice Comorbidities Manager, to help provide guidance for healthcare professionals who are managing patients with multiple diseases. In Europe and the Western world more broadly, 1 in 3 adults have 2 or more diseases. So it's a massive problem. Used to be generally an older person's problem, but actually it's not just older people anymore. And so and surprisingly, all the guidelines and most of the knowledge resources, apart from ourselves, are focused on patients with single diseases. So there's been this mismatch between what the need of patients and populations and healthcare professionals are, and what guidelines have been providing. And so BMJ Best Practice Comorbidities Manager has moved into this space to see if we can help. And also, I think another success of BMJ Best Practice is making it available to healthcare professionals by improving the website, improving search, having a mobile version, having an app that's quick to download, uses minimal space on your phone, and that so it's really responsive. So we talk to junior doctors or residents all the time, and we try and meet their needs. And one of their needs is speed. They want to find answers really quickly, and we say how quickly, and they say seconds. So that's the modern
Very quickly.
challenge that yeah, absolutely, that we're trying to deal with. As well as that, we provide resources for patients, patient information resources, as well as the evidence, as well as other resources for professionals. Because to implement evidence-based medicine, it's partly about the evidence, but it's also about the professionals, and it's also about the patients. And you really need to do all three.
Okay, so what made you join Barcelona Health Hub?
So really, we want to kind of speak to healthcare professionals, medical directors, senior leaders locally to find out what their needs are and to get feedback on our resources, such as BMJ Best Practice, and to find out whether it's meeting their needs and what they want to achieve through using it. So it might be using it to drive quality, clinical quality improvement, or shorten length of stay of patients, or avoid readmissions. Maybe it's about the treatment of patients, older patients with multiple conditions, and we like to know, well, what conditions would be a particular focus, or what are the priorities that these people are trying to achieve. So we're the international organization, but we can only really achieve our aims of helping to drive a healthier world through local contacts, and to finding out what the local context is and how we can fashion our resources to meet needs. And let me give you a practical example of that. I was talking about access earlier through mobile and app and website, but increasingly we're finding that people want the content to be available through the electronic healthcare record or the electronic patient record. And so we're keen on integrating our resources into the electronic healthcare record. So we'd like to find out, well, what are the electronic healthcare record providers and how do they operate, and what levels of integration with the BMJ best practice might be achievable and acceptable and will satisfy users, because that's what we're trying to do.
That sounds great. What do you expect from Barcelona Health Hub towards the future, apart from this?
Yeah. So we want to kind of find out what the challenges are and how we can help healthcare professionals meet those challenges. We want to attend events and network with both senior leaders and also juniors, and we also want to partner with various organizations, and BMJ Best Practice is improving all the time, and it's expanding all the time. And so we're looking at creating new content, as well as covering the 1,000 topics that we do now. We're going to expand that, but we don't want to be sitting in an office in London deciding what the new diseases that we cover should be. We want them to be genuinely based on the needs of patients and populations and healthcare professionals around the world. So we're kind of in listening mode. We want to find out these things.
Yeah, this actually makes a difference between a company and another one. So that's great. So if I may ask, can you tell us a little bit more about BMJ Best Practice and who uses the tool currently, for example?
Yeah, so to start with the second question, this is a who uses the tool. This is a generalist resource, so it's aimed at generalist physicians working in primary care, secondary care, and tertiary care as well. And it's used by junior doctors or residents, as they're called in lots of places, but also by senior doctors as well. And I've focused on doctors, but over the past 10 years, really, BMJ has grown its interprofessional audience. So today we increasingly get feedback from nurses or nurse practitioners or advanced nurse practitioners, also physician associates or physician assistants, and other healthcare professionals from pharmacists to paramedics. And we're really proud of that and glad about that because health, the management of patients and provision of healthcare is a team-based activity. A single physician acting on their own won't really be able to achieve the outcomes that are necessary to drive healthcare professionals, to drive improved healthcare. And so we need to provide resources to the team. In terms of more about BMJ Best Practice itself, it's digital clinical decision support for healthcare professionals that also provides information for patients. It also provides multimedia videos of how to do common and important medical procedures. It also provides medical calculators. You can work out everything from your patient's body mass index through to their Apache score if they're going to be admitted to intensive care. There's a CME, continuing medical education, or CPD tracker. So doctors and other healthcare professionals can track and record the learning and their use of the tool online, and that happens automatically. So all these different resources, which I could go on and on about, but I'm sure we want to keep this reasonably short. But two final points is that healthcare professionals are short of time. So they need all these resources in one place. They can't afford the time to go from one website and then to another website to find calculators and another website to upload their CME. They need it all to be automated in one place without interrupting their clinical workflow. And that's what we're trying to provide. And my absolute final point, I promise, is that all these resources and things that I'm talking about that have been designed to help healthcare professionals are not things that we dreamed up on our own. It's only through talking to doctors and other healthcare professionals, junior and senior, in many countries around the world who told us that we need these things. So we hope through joining the Barcelona Health Hub, we'll find out further things that we should be providing, and we're committed to continually improving the resource that will be able to do that.
Well, we hope you find everything you need here at Barcelona Health Hub, and if we can help you with anything, just let us know. So thank you so much for your time and for this interview, Kieran. It was a pleasure to talk to you. And well, we'll see you back with more Meet the Members interviews. So bye.
Thank you. Thank you.